Thank you everyone for joining us here today. My name is Rhys. I'm from the admissions team. I'm here to speak with you all about the online MPH program. I'm going to be joined by Dr. Alexis Paton and today we'll just go into more depth about the program in detail during this chat. To give you all a bit of an outline on how this will work, I'm going to start off by speaking about some details related to a program and the university at large. Then I'll hand things over to Dr. Paton. Afterwards, I'll jump back in and then we'll have a Q&A section at the end. So, well, to start with, let's just start talking about the university. So studying with Aston Online, specifically about the MPH program, we've designed it so that it equips you with knowledge and leadership skills to improve health outcomes at scale. You'll gain essential skills in epidemiology, health promotion, and public health evaluation. You'll gain skills in research expertise and critical thinking skills, and you'll make an impact in your community. That's what we hope you will get out of the program. About the university at large, so we try to have a flexible and student-centric learning experience. We're triple gold rated, the highest possible rating for the Teaching Excellence Framework, the TEF, in 2023. And we were a top 25 UK university in the Guardian University Guide for 2025. We were also University of the Year for Student Success by the Daily Mail University Guide in 2025. So that's just some quick facts about the university at large. So then you might ask, why Aston Online? Aston University Online offers various advantages, making it an appealing choice for prospective students globally. You'll get round-the-clock support, expert tutors and one-to-one feedback. You'll have a dedicated student success team. You'll have a digital library, resources and material available 24/7 through the online learning platform. And you'll also get complimentary full access to Adobe Creative Cloud. Now, part of the benefits of this program is that you can earn as you learn. You can spread the costs if you pay monthly or in installments. So over the 24 months, you pay each month. There's no extra fees or interest associated with that. There's no need to take time out of your employment. I would say 90% of the students I work with for Aston's online programs are full-time professionals. So we do understand the struggles that a lot of students face. You also may have funding opportunities, especially if you're based in the UK. You can look at Student Finance England, Student Finance Wales, and potentially other opportunities as well. This program is designed so that you can take control of your schedule. You can access the course materials anytime, anywhere. There's no limitation on that. You can study at your own pace. We usually recommend, I believe, 15 to 25 hours per week, and the program is 100% online and fully asynchronous. Now, I'm be happy to answer any more questions about what I've just covered at the end of the Q&A, but for the time being, I'm going to pass this on to Dr. Paton.
Hello, everyone, and apologies. Rhys is going to have to help me out here, and I'll have to pull a Chris Whitty and go next slide as we go. Welcome. I'm really pleased to see that you're interested in our Aston Online program. I thought it might be useful just to give you a little bit of info in terms of requirements, but also what's the course going to look like? What are we going to learn together? What can you expect to get out of it? So the first, just to be really clear, there are a few requirements that we do have for the program. So the first is that you have equivalent of a UK 2.2 or a lower class honors degree, and this can be a recognized international equivalent as well. It doesn't have to just be the UK. And we also do have some English language requirements that we ask international students to meet. And this is because all of our teaching is in English and also all of our assessments are in English. So we do need a certain level in order to assure success for you as a student. For us, really, this is about offering an experience-based entry for students. You know, this isn't just about someone who might have a degree level qualification for what they want to do, but you want to be building professional experience. You want to be building your qualifications around that in a master's program. And so this is also kind of quite a helpful degree in terms of progression for your own professional lives, or perhaps you're looking to move into more of a public health sphere. The master's can really help you with that. Next, please. So just a little bit about what the program looks like. So it is, of course, online, and it's a distance learning program. So the idea is that you are the one that sets the pace. and you have 24 access to your study materials. So if you fancy doing your module at 2 a.m. on a Tuesday, you can absolutely go ahead and do that. The tuition fees are a set amount of $12,500, and as Rhys was saying, you can spread the cost out about this. So this isn't having to come up with that money up front. This program has also been designed to be part-time, which is why it's so helpful if you want to also be working, and it's why so many of our students work with the Aston Online degrees, because you will actually do the degree over a 2-year period. So it does give you quite a lot of flexibility for the other things that are happening in your lives. So what are some of the things that we will probably learn? Well, obviously we're going to learn quite a lot about public health, but in particular, you're going to learn about how do you apply that knowledge in whatever realm it is that you're interested in. You might already work in a health or clinical sector, or maybe you're in the third sector, charity, something like that. But you're going to learn, how do we apply that knowledge? And in particular, what does that mean when we're thinking about public health practice, and how public health practice really interacts with the policies that we have? Because of course, all of healthcare is greatly influenced by the kinds of policies a country has, and public health is no different. You'll learn how to solve some of the more complex public health challenges that we have, and in particular think about, what does it look like to tackle a public health problem or challenge? What does it look like to create health promotion campaigns, things like that. Another key part that is really sometimes not obvious with public health is that, of course, public health tends to be a real team effort. It's all about collaborating. You tend to be working across different agencies, different groups, different communities. And so one of the things that we are keen for you to get out of this program, and it's been designed in this way, is that you learn how to not just collaborate with other people to work, but how can you be the leader? How can you effectively lead? Maybe it's a project, maybe it's a group, whatever that might be, a sector in a local authority. Also, public health is really interesting because it tends to pull its information from lots of different places, and data is really important for public health. We need that population level. Of course, it's a master's degree, so we are expecting you to write a dissertation, and so we'll be supporting you all the way along the way, giving you the skills and training to actually do your own research project, and that will be the basis of your dissertation. And then finally, kind of the overarching message of our MPH program is that it's really important to understand the context in which people make decisions about their health, have choose different behaviors, act in different ways. That context is critical to really capturing why a group or an individual is healthy versus a group that is not. And one of those things that is underlying all of that, especially here in the UK, but of course across the world as well, is inequality. What does inequality, what influence does inequality have on health? Next, please. So I've told you a little bit about how to get in and what to expect, but let's talk a little bit about what the program looks like itself. So like I said, it's over a 2-year period, and it's part-time. And within that, you'll have 3 modules. And each module is designed to bring together all the information that you need in a kind of stepwise fashion. So you'll start with foundations of public health. And this is really what it says on the tin. So what is public health? Why do we need public health? What has public health looked like over time? What are some of the different ways that public health interacts with the systems, and why do we need it? We also have approaches to public health, which is our next module. And approaches to public health, they are really focusing on, what are the different ways that we do public health? Because public health is like a big word, but actually it can be broken down into things like health promotion or prevention, or health education, screening programs. And so what are those approaches? Methodologies of public health. So these are to really help us understand the different ways that we not just do public health, but actually use that kind of data I was talking about before to inform our practice. And in particular, this is around the different types of research methods that we use. So things like epidemiology, which is the use of population level data to understand health at the population level and trends in health at the population level, but also things like how do you interview someone? How do you run a focus group? How do you write a survey? And then we also have emerging areas in public health. So the emerging areas in public health is where we really have quite a lot of fun in this module, because this is about what is trending in public health. What are the things that we need to be focusing on right now? What kind of changes are happening in the national, international environment that we have to be paying attention to as colleagues within the public health sphere? You'll also get to benefit from what's called the Aston Global Advantage and Research Methods course, which runs alongside the Aston MPH Online. And this is really about providing those everyday skills that you need when you're just working in employment, but also what kind of research methods might you need, not just for your dissertation, but perhaps you want to continue doing research in the future, and how can we skill that up for you? And then, of course, a big part of the program is the dissertation. And this is an independent research project that you'll get support from the staff, the Aston Online staff, for you to run on your own. So the idea is that you come up with the topic. We always suggest you choose something you're very interested in or passionate about, and you decide, what are the questions you want answered? How are you going to answer them? What kind of ethical approval do you need? And then, of course, you go out and you do that research, and you write it up and you analyze it to tell us why that research is so important. Next, please. Just a little bit about what you can think, what kind of jobs you could do when you have an MPH. I mean, the MPH is a very versatile degree, which is really handy. So there's lots of different areas. So, of course, you might find that you're just really into data. You find that fascinating. And if that's the case, there's loads of roles around for epidemiologists and statisticians in health. And that might be where you find your niche. This might be within a healthcare service or a local authority. Then, of course, you might find health research is just incredibly interesting. And there are lots of opportunities within across the sector, both in universities, but also in charities, in local authorities, in the NHS, even in sort of think tanks around public health research. You might be, again, more interested in that science, statistics side, I should say, and go into something like health informatics. And another example could be working as an environmental health practitioner. But of course, people go on from our degrees to do quite a wide range of things. So we have clinicians, whether that be nurses or doctors or dentists. We have people working in local government. We have people within the NHS. And then, of course, NGOs and third sector organizations, actually all around the world. So that just gives you a bit of an idea of what you can do with that. Of course, you may also be taking this MPH for your own professional progression within the job you already have, which is fantastic. We're happy to support you with that too. Next. I think that might be you, Rhys. Am I handing back to you?
I believe that is back to me. All right,
Yes.
excellent. All right, so we'll just go essentially on this side, we'll talk about, well, the digital campus. This is the thing you'll be using when you join the program to essentially stay engaged, stay informed. Aston Online is a dynamic global learning environment. By regularly logging in, you'll stay on top of all your courses, you'll receive the latest updates from your tutors, and remain connected with your fellow students. It's very easy to use, it's very intuitive, and we hope you'll enjoy it quite a bit. So I'll go into the application process a bit where I come in during your student journey. Your success is our priority. We aim to make the application process quick, simple, and supported. So just go through the various steps. Step 1, you'll complete your online application form if you haven't done so already. Then a member of the admissions team will be in touch to discuss your career goals and the course details. So that will either be me or one of my colleagues. You can find the admissions form, the application form on the main Aston Online website. It should just be a big apply now button. Step 2, submit for required documents as instructed by your admission advisor. This can include your most up-to-date CV, personal statement, references, and academic records. Depending on your application, we may require extra documentation, but we can definitely talk more about that when you reach out to us. Step 3, you await a decision from the admissions team who will be in touch throughout the process to support you. So once you've submitted all your documents, you just sit back, let us do the rest of the legwork. We'll review things, see what we can do to help you, see if we can't get you an offer letter. This can usually take between 1 and 2 working days, depending on the complexity of the application. It may take longer. We may have to come back to you to ask for clarification or more documentation, but we'll be in touch pretty consistently to make sure that's as smooth and easy as possible. Step 4, you accept your offer by paying your deposit and arranging your funding, and then get ready to start. So once you receive your offer, you just reply to the email saying you accept it, at which point you'll be asked to place your deposit payment that will secure your spot on the program for the next intake. So here's some tips and tricks about your application and your cover letter and personal statement, all that good stuff. So with your CV, you want to make sure that you tailor the CV to a specific university program. So highlight academic achievements and relevant coursework, as well as any professional work that you feel would be relevant to the program. This is really important. It can really make your application stand out. For your personal statement, you want to begin with a compelling introduction that captures our attention, and then showcase relevant accomplishments and experiences. Connect your career aspirations with the program's strengths and conclude with a strong closing argument. My tip is always start with why you want to do the program, what you hope to bring to the program, and what you want to do after the program. For your academic records, we want you to gather all transcripts from previous educational institutions, including translations if the transcripts are in another language. I am terrible with languages. Please make sure it's in English. Highlight relevant coursework and achievements. Provide contact details for academic referees if required. So, yep, if you don't have your previous transcripts right now, I'd highly recommend getting in contact with your previous institution sooner rather than later. Some of them can be a bit slow about getting those to you. For English language requirements, this will come down to a bit of a case-by-case basis, but applicants whose first language is not English will be required to provide evidence of an English language qualification. Alternatively, you can speak with me or another admission advisor, and we'll be able to help you and figure out a solution. Once you're on the program, you'll have continuous support throughout it. You'll have access to a student success team led by Gwyn Wilson, good colleague of mine. He'll be there to help you with every step of the way. You can see his picture here. You'll also have access to the career support team. They'll be there to help you during and after the program as well. So continuous support, you'll get comprehensive support from start to finish with our student success team. They'll help you with a smooth onboarding process, and they'll let you settle in, and including an induction to the program that will start a week before the official start date when teaching starts. You'll also have access to a student hub with a range of comprehensive resources and support materials, and you'll have continuous academic support throughout your studies. Access to Aston's award-winning careers team even after graduation. So that's the long and short of it. We'll now do some Q&As. I can see there's already been some messages in chat. We'll see what we can do to help you here.
That's mostly me. Sorry. I've
Oh,
so what I've done is
see.
I've popped the application link into the chat just in case that's helpful. But
No,
also
that's brilliant. Thank you.
if anyone's interested in the kind of stuff that we get up to, the MPH teaching team that's part of the MPH Online, you might want to have a look at a recent documentary that just went out on the BBC that we're a part of, where I talk about understanding risk in a public health emergency. So we're just give you a bit of flavor of what we get up to.
Well, so yeah, if anyone has any questions, just pop them in chat now, and we'll do what we can to help. We'll give this, depending on how quick and fast they come, we'll give this about 10 minutes. If more time's needed, we can take that though. Okay? All right, let's see.
So we have one question here saying, I'm a midwife with a degree in midwifery. I have a cumulative GPA, over 6 years work experience. What benefits will the MPH Online have for me? Will it mean moving away from midwifery? And Christabel, you say you're from Ghana. So, I mean, the MPH Online will provide you with the opportunity to extend what you do in midwifery. So if you want to stay in midwifery, there's nothing that would stop you. In fact, early childhood, perinatal care and early childhood care are a big part of public health. And so it may be that this allows you to expand the kinds of work that you do, perhaps in communities or being part of wider screening programs, if that is of interest of you. So there is a big benefit in taking the online course, because it allows you to continue to be a practicing midwife, won't get in the way of that. And at the end of it, you have a few more options about where you might want to be taking your career in the next steps. I hope that's helped answer that question. Do we have any others?
I see one from Lisa in the chat.
This be coursework assessed or combination of coursework? Okay. So the assessments are a combination of coursework and examinations at the end. Yes. So each module has effectively like a coursework assignment partway through, and then there's a final exam. The exam is probably not the right word. Often you're asked to write an essay or a report. You have a final assessment, I would say, is a better way of putting it. Yeah. We've got another question here about how long the dissertation module lasts. So it's your last module. So you will get, it's about 5 or 6 months, isn't it, Rhys, for that final module?
I believe so in total.
Yes.
Yeah.
Yeah. So because you get because it's part-time, you get that a little extra time. Yeah. Lisa's asking, will there be an opportunity for group work learning? Yes. So there is, you actually do have group work learning, especially as part of those coursework assignments that you have at the partway period of the module. We really encourage people to work together. And sometimes it's about reading each other's discussions and getting involved in each other's discussions on the discussion forums. And sometimes it's about actually, working together remotely, which in public health is really common. We got any further questions? You don't have to. But we're always here to ask that you can ask us questions as well. Yeah.
Another one from Christabel. Yeah, I do believe, you will be able to attend the graduation ceremony. It will be open to everyone who's part of the program.
Yes. Right. Do we have any more burning questions, or sometimes hard to tell because we never know if people are typing or not? We've got a question from, this is from Lisa, isn't it? Could my research idea span across the NHS and into the community? Yes, of course. The remit is that it's public health, but where that happens is kind of up to you. Really, the only thing that puts boundaries around your project are, can you do it ethically? it can't cost too much money. And of course, remember, you do only have a short period of time to do the project. So sometimes there's quite grand ambitions, and we have to just choose an aspect of the project that's appropriate for the time scale, so that you can be the most successful at that project that you can be. Yeah. Oh, thanks, Lisa. Good to know. Yeah, so online classes can be really different, Christabel. Absolutely. I just recently actually did an online diploma in health economics, and it was a change, but I really enjoyed the fact that I could go at my own pace. Because sometimes there were topics that I just steamed through because I just really got them. And it was nice to be able to just say I'd done and dusted it for the day. And then it was also nice for some of the topics where I had to go back and have a think and maybe review something a few times so that I really understood. And what I found really helpful was that I could always pop something onto the discussion forum and say to one of my fellow students, and also to the tutors, like, oh, I think this is this topic. Am I getting this right? And you got feedback all the time. So I really enjoyed it, actually. It's nice to set your own pace.
Any more questions? I've seen we've had some questions from two, but I believe we have Tonya in the chat as well, and I've not seen any from Tonya yet. Or is it Tanya?
You don't have to, by the way.
Yeah.
There's no requirement here. Don't worry.
Give it a couple more minutes and then wrap up if nothing else comes through. I did also just mention on this page here we now have on my shared screen, if you wanted to chat more in depth at a later point, I'd recommend using that book a call with advisor QR and just either selecting myself or one of the other advisors to chat with.
Great. Well, it seems like everyone's asked their questions based on
Yeah.
the comments in the chat. So I just wanted to say thank you very much to everyone for attending today. And I really hope that we see you in our next cohort of students. So, hopefully you'll apply, and we'll be talking again soon.
Brilliant. All right. Well, thank you everyone for coming. And yeah, chat with you all soon. Bye now.
Bye.